Welcome back. This third video will talk more about altered mental status in general and the different causes of that. Altered mental status is just a blanket term, and it means that any state of awareness that differs from a normal awareness of a conscious person. So one of the basic teachings of EMT is with altered mental status, always assume trauma until otherwise proven. So now we're going to talk about different causes of altered mental status. And number one is hypoxia, which is basically a condition in which the body as a whole, which is generalized hypoxia, or a region of the body, which is tissue hypoxia, is deprived of that adequate oxygen supply. So some of the other signs and symptoms of hypoxia, besides altered mental status, is obviously respiratory difficulty and cyanosis, which you see here in the picture. One of the things here is, just like trauma, you need to always assume hypoxia with altered mental status until you can prove otherwise. So the treatment for hypoxia is obviously oxygen in various forms. Here the guy in the picture is on a simple face mask, which normally we don't use in pre-hospital, but we do use either a nasal cannula at 1 to 6 liters or a non-rebreather at 10 to 15 liters. So another cause of altered mental status would be hypoglycemia, which we've covered in another video, but real quickly, it's usually blood glucose levels less than 60. They can appear to be intoxicated. Remember that they're usually going to be pale, cool, and diaphoretic, and that without treatment it can rapidly lead to coma and death. So treatment of hypoglycemia would be oxygen, suction if it's necessary, oral glucose if the patient is conscious, and if they're unconscious, you would request ALS or take them to the hospital where they would administer IV glucose. So now we're moving on to seizures. And a seizure is just a sudden change in sensation, behavior, or movement caused by irregular electrical activity of the brain. There are 3 phases, both the tonic, the clonic, and the last one is the postictal phase. So there's lots of different causes for seizures. One of them will be a toxin, tumors, congenital defects. Trauma can obviously cause it. Infection and fever, which is the #1 cause in pediatrics. There is also epilepsy, stroke, hypoglycemia, eclampsia, which is a pregnancy problem, hypoxia, and then just unknown causes. So there's lots of different types of seizures. The first one I'm going to talk about is a simple partial seizure, which is also called a focal motor, focal sensory, or a Jacksonian seizure. And it's characterized by tingling, stiffening, or jerking in usually just one part of the body. So the next type is a complex partial. This type of seizure, also called a psychomotor or temporal lobe seizure, is characterized by abnormal behavior, but that widely varies from person to person as in the type of behavior they produce. So general seizures, usually called a grand mal seizure, is characterized by unconsciousness, major motor activity, and usually loss of bowel or bladder control. Absent seizures are a brief temporary loss of concentration or awareness. These are also referred to as a petit mal. Usually that's characterized also by just basically a patient staring off into space, and when they come to, they didn't even realize that they were kind of spaced out there for a minute. So last but not least is a status epilepticus. This is usually a grand mal type seizure, although it doesn't necessarily have to be. It's a life-threatening condition. It's 2 or more seizures lasting 5 minutes or more without regaining consciousness. So there are some questions that are specific to seizure and seizure-like activity that we as EMTs need to ask the family and bystanders that were there. One is being, what was the patient doing before the seizure? What movements were exhibited during the seizure? Was there a loss of bowel or bladder control, which obviously you can see for yourself? And what did the patient do exactly right after the seizure? And length of the episode. Now remember that length of the episode you have to kind of take with a grain of salt. To somebody that's there, a 1 minute seizure, they may think it lasts about 5 minutes. So you have to kind of adjust for those kind of responses. So now we're going to talk about treatment of seizures. If you arrive and the patient is still seizing or the patient has a seizure while you're there, first thing, lay the patient on the floor if they're not already there. Administer oxygen, usually high concentration oxygen by non-rebreather. Suction if necessary, but be aware of putting anything in their mouth, especially between their teeth, because they will usually clamp down violently and you could lose whatever that you stuck in there and then there again create an airway problem. If you can, either during the seizure or right after, place them in the recovery position on their left or right side. Another thing is protect the patient from harm. Make sure that there's nothing around them, especially if they are doing complete body movements such as a grand mal type seizure. Make sure they can't hit their head against the floor, place a pillow underneath it, move things away from them, try to restrict it, loosen restrictive clothing, those kind of things so they won't harm themselves during the seizure. But by no means hold them down. Do not try to stop their activities by physically restraining them. So postictal phase, that is the phase directly after seizure-like activity. They can be in this phase for 5 minutes up to 30 minutes. Sometimes they have no postictal phase at all. It just goes differently from patient to patient. Most of the time the patient is physically exhausted, especially if they had a grand mal type seizure. Evaluate their airway and O2 needs. They may or may not need anything. They may need some supplemental oxygen or complete non-rebreather. Assess for associated trauma, especially if you weren't there. The fall, they may have bit their tongue or hit themselves on anything that may have been laying around prior to you getting there.